Now we'll look at a pathological feature. Alright, and I actually came across this when I was reading about ectopic pregnancy. Alright, so they call this the Arias-Stella reaction. Arias-Stella reaction, anyhow you actually want to call it. So for the Arias-Stella reaction, we'll just talk all about it, try to discuss it, then talk about disease conditions where you can actually find it. So we said that it's a benign change in the endometrial glands. Okay, now it's caused by what? Hormonal stimulation. Alright, often during pregnancy, or maybe an ectopic pregnancy, or you could say gestational what? Trophoblastic disease. So it's a reactive change in the endometrial glandular cells due to what? Progesterone levels are so high. Do you understand? So any conditions that can actually make progesterone levels go so high, like pregnancy or anything that will mimic pregnancy. So typically in the presence of chorionic tissue. So it was actually discovered by what? Dr. Javier Arias-Stella in 1954. So what are the things you can see? Alright, you see nuclear enlargement, so glandular cells will become enlarged. Alright, irregular cellular membranes, vacuolizations. So in the middle you have like holes, that's vacuoles. Alright, then granular chromatin. Okay, so subtypes, we have the minimal atypia where there's a slight nuclear change. Early secretory patterns mimic early pregnancy endometrium. Have the hypersecretory pattern, there's prominent secretory activity. Okay, the regenerative or non-secretory pattern. Then we have the monstrous cell pattern. Okay, so clinical significance, you see it in normal intrauterine pregnancy or ectopic pregnancy or gestational trophoblastic disease or hormonal therapy. Like once you have anything that will make progesterone levels in your body go up so high, alright, you could actually have the Arias-Stella reaction. Okay, so that's what we got.